Hello viewers, welcome back to my channel. As per tradition, Wednesday videos will deal with MRCS ENT OSCE. I've been slightly irregular and thank you so much for pointing it out. After uploading more than 130 videos, it just becomes a little bit tedious at times, but thank you for keeping me on my toes. Today's video, we will talk about cranial nerve examination because cranial nerves is a very important topic for ENT, and not just facial nerve, not just eighth cranial nerve. Those are definitely important, but the other cranial nerves also are important. This can be asked in the manned exam of MRCS ENT OSCE, and you may have to finish this examination of all 12 pairs of cranial nerves within 7 minutes. So let's get into it. The first cranial nerve is the olfactory nerve, which is responsible for the perception of smell. So you have to perform smell test. You will ask the patient to close their eyes and bring a commonly known odorant, such as maybe coffee or peppermint. Ask the patient to close one nostril and sniff with the other and repeat the test on the other side. And then you have to understand whether the patient was able to identify the odorant correctly or not. So it's very important the patient keeps the eyes closed because you don't want any other cues. Although in the ideal world, there are some protocols like the University of Pennsylvania smell identification test, there are smell discrimination tests, smell threshold tests, all these things are there. But when you don't have anything at your disposal, you should have some commonly known odor, such as coffee or peppermint or rose, which can be easily disguised so that the patient cannot understand by their appearance. Okay, maybe it is kept in an unlabeled identical bottle, and you just present the aroma to the patient with their eyes closed and ask them to sniff with each nasal cavity individually. So this is how you test olfactory nerve. This is the first cranial nerve. The second cranial nerve is the optic nerve, which requires extensive analysis. It's a multi-part process. So we have to look for essentially the following things: visual acuity, visual field, color vision, as well as light reflex and accommodation reflex. Okay, so 5 things we have to look at. Visual acuity can be assessed with the help of Snellen's chart. In case the patient is illiterate, then there is something with a C chart where the patient only has to mention which side C is open. Now, if the Snell's chart is not available, then finger counting can be done from variable distances. Very important to remember is patient should close one eye with their own hand and this part of the hand, not the fingers, because the fingers can have gaps. This part cannot have a gap. So close one eye properly and ask the patient to read with the other eye. Okay, and then repeat on the other side. This is visual acuity with the Snellen's chart. So you have to ask for Snellen's chart or just ask for finger counting. How many fingers? Also like this, fingers like this, not like this. How many fingers? Okay. How many fingers? Oh, this is okay. This is also fine, but like how many fingers am I holding up? Like that. Anyway, after visual acuity, you have to look for visual field, which is testing from the peripheral vision. So you stretch your hand to one side and ask the patient to confirm when they can first see it. And of course, reach from further in, from diagonally in, horizontally in, from diagonally down, upwards like that. And again, with covering one eye through this part of the hand. Okay. So you test both eyes for visual field. This is the peripheral vision. Then you have to check the color vision with the help of Ishihara chart. Again, you have to ask for Ishihara chart. So Ishihara chart basically is a pattern. A number is there in the pattern of colors. So if they can read the correct number, say 37 written in blue in a pattern of green, like that. If they can identify the colors properly, the numbers properly, not the colors. If they can identify the numbers properly, then Ishihara chart or color vision is normal. So you have to ask for Snellen's chart for visual acuity testing and Ishihara chart for color vision testing. Now you check for light reflex. For light reflex, you need a torch. Again, you have to create a barrier near the bridge of the nose. You present the torch onto the pupil from the sides on one side. Check if the pupil is constricting on that side and also check the other pupil if that is constricting or not. This is the consensual reflex. Again, you cover this eye like this, and again light from the torch on this eye and check the other eye as well. So ideally the pupil will constrict in response to light on the side that you're testing as well as the other side as well. This is your light reflex. Then you check the accommodation reflex. In this case, you ask the patient to focus on the distant wall, focus right ahead, and then you bring a finger 15 centimeter from the tip of the nose. 15 centimeter tip of the nose. Then ask the patient to look at the finger now. When they are looking at the finger, you should also examine if there is any deviation in the pupil, like squint or not, or any kind of nystagmus or not. So if the patient is immediately able to look at your finger without any deviation, without any nystagmus, then that is accommodation reflex normal. So this is how you test for second cranial nerve. For third, fourth, and sixth cranial nerve, we are testing the movements of the extraocular muscles. From our ophthalmology knowledge, we will know that all extraocular muscles are supplied by oculomotor nerve except lateral rectus, which is supplied by abducens nerve or sixth nerve, and superior oblique, which is supplied by the fourth cranial nerve or the trochlear nerve. All three LR6SO4. That is the mnemonic. So this is tested simply by asking the patient to look at the finger. In this case, the finger is placed 30 centimeters away from the tip of the nose, not 15 centimeter. 15 centimeter is for accommodation reflex. So 30 centimeter away from the tip of the nose, and this patient is instructed to follow the movement of the finger without moving their head. And this finger is now moved in an H-shaped fashion, like this. H, you found, and go back up, then the middle again, then this side, then again up, again down, again up, and back to the center. So you form an H and you look if the patient is able to follow the movement of your fingers properly or not. In this case, you can look at both the eyes at the same time. You don't need to check individual eyes separately. So you have covered 1, 2, 3, 4, 6. Now you're left with 5. You skipped 5. That is the trigeminal nerve. Now trigeminal nerve is a mixed nerve, so we have to test the sensory component as well as the motor component. Trigeminal nerve has 3 divisions: the ophthalmic division, the maxillary division, and the mandibular division. Now, trigeminal nerve provides sensation to the face. The ophthalmic division is roughly this, the forehead part. So you can take a cotton wool, ask the patient to close their eyes. First, place the cotton wool on the sternum and assess if the patient can feel the sensation of the cotton wool on the sternum. That way you know that they have some sensory properties in other parts of the body. So patient is familiar with the sensation of the cotton wool. Ask the patient to confirm, can you feel the cotton wool? They will say yes. Ask them to close their eyes and then first test on one side and then compare with the other side. This is the ophthalmic division. Then the maxillary division, compare with the other side. Mandibular division, compare with the other side. That's the sensory component of trigeminal nerve. Then you check the motor component. Motor component is largely the muscles of mastication. That is temporalis muscle, masseter muscle, lateral and medial pterygoid. So first you check for the bulk. This is the temporalis muscle bulk. Ask the patient to clench their teeth and you can feel the bulk of the temporalis muscles on both sides. Then feel the bulk of the masseter muscle by clenching the teeth. So you feel the bulk of the muscle. You are checking for muscle wasting or not. If the motor component is compromised, the muscle wasting would have taken place. Then you check for functions. So you place your hand below the chin, ask the patient to open their mouth. Place the fingers below the jaw. Ask the patient to open their mouth. In a pathology, there will be deviation to one side. If it's not present, then this is normal. Also, you should check for jaw jerk test, where you place a finger on the chin and tap with a tendon hammer, as is used in neurology examination. So tap with a tendon hammer. Ask the patient to keep their mouth slightly open. When you tap with a tendon hammer, normal reflex is slight closure of the mouth. When you tap this finger with a tendon hammer, normally there will be slight closure of the mouth. Abnormal response is brisk closure of the mouth. So this is how you test for trigeminal nerve. Next, we test for seventh cranial nerve, which is it again is a mixed nerve. So we have to check both the sensory component and the motor component. Very important to remember that if the test is for facial nerve, we have to test the sensory component also. Often we don't remember the sensory component at all. We just test the muscles of facial expression and that's it. That's not it. We should also test the other functions, and I'll explain here. But of course, you start with the motor component, that is the muscles of facial expression. So first is the frontal belly of occipital frontalis. So we ask the patient to look upwards, and we look for wrinkling in the forehead bilaterally. We ask the patient to frown, and then we look for the corrugator supercilii, this eyebrow muscle. Bilaterally, ask the patient to frown. Then we ask the patient to close their eyes, and we try to open bilaterally one by one. This is the functioning of the orbicularis oculi muscle. Then we ask the patient to blow their cheeks or puff their cheeks, and we tap each side to see if there is any air escape or not. This is the functioning of the buccinator muscle. We ask the patient to smile to see if the angle of mouth is not deviated to one side or not. This is the anguli oris muscle. I forgot the exact name, but smile to see for any deviation. You should also ask the patient to whistle, or whistling is a function of the orbicularis oris muscle. And finally, you have to check for clenching of teeth and trying to expose the teeth. You expose the teeth with clenched teeth, and this will show the contraction of the platysma, which is supplied by the cervical division of the facial nerve from the pes anserinus. This is the terminal branches of the facial nerve in the substance of the parotid gland. So this concludes the muscles of facial expression, but this does not conclude the examination of facial nerve. We also need to look at the sensory component. So we have to ask about, do you have any taste disturbance? Or ask the patient to close their eyes and place a commonly known taste on the tongue. The anterior two-thirds of the tongue receive taste sensation from the anterior two-thirds of the tongue is from the chorda tympani nerve. Chorda tympani nerve, as we know, is a branch of the facial nerve. Also, in a very ideal scenario, we should also test for tear function, that is formation of tears, that is the greater superficial petrosal nerve, which is Shermer's test. But if you don't do that, it is not that frowned upon, but you definitely should test for taste, or at least ask if there is any abnormality in taste function. You should also ask if the patient is hearing sounds abnormally loudly or not. This is the test for stapedius muscle. The nerve to stapedius is also a branch of facial nerve, and the stapedial reflex is largely a protective reflex which protects the inner ear from loud sounds. So if the patient says, I am really hearing intolerably loud sound, then maybe the nerve to stapedius, which is a branch of facial nerve, is not functioning properly. So muscles of facial expression, nerve to stapedius, and chorda tympani function, that is the taste function, all of this should be assessed, and this will conclude your examination of facial nerve, or the seventh cranial nerve. The eighth cranial nerve is the vestibulo-cochlear nerve, so it has hearing function as well as the dizziness function. That is the maintenance of balance function, not dizziness. If it goes all right, then it causes dizziness. So vestibular function also has to be tested, and hearing function also needs to be tested. For a vestibular function, choose one test. You can't do the entire battery of tests and expect to finish within 7 minutes. So choose any one test, such as say Unterberger test, where the patient is asked to stand in one spot, raise their hands up straight ahead, and march in the same spot, raising their knees up to waist height, up to 20 to 30 times. March in the same spot by raising their knees up to waist height. If there is no swaying to one side, then this Unterberger test is believed to be normal. For hearing test, you can do free field hearing test, where you can stand behind the patient, occlude one arm distance, occlude the tragus with the finger, and stand behind the other side and whisper some numbers, then slowly increase the intensity and ask the patient to repeat. If they can respond to your whispers, then increase intensity, ask them to repeat. Of course, if they can respond correctly to your whispering, they'll be able to respond correctly to louder sounds also, but you should do the entire thing. Whisper, normal conversation, and then loud sound. So you're just uttering numbers, first as whispers, then as normal conversation, then loudly. And then you repeat on the other side as well. So this is free field hearing test. Of course, you should also perform Rinne's test and Weber's test and absolute bone conduction test. This also assesses the hearing function of the cochlear component of vestibulo-cochlear nerve. Okay, now that we have concluded 8th cranial nerve, we move on to 9th and 10th. That is glossopharyngeal and vagus. 9th cranial nerve, largely you can ask the patient to open their mouth and say ah, and look at the movement of the soft palate and the uvula. Okay, if the soft palate is moving symmetrically on both sides, then glossopharyngeal nerve is fine. Also, you can choose to induce gag reflex, but this is not a good test. This is not something which is recommended. So try not to induce gag reflex to test for glossopharyngeal nerve. Just look at the symmetry of the soft palate and the uvula while saying ah. And vagus also requires assessment by flexible nasoendoscopy, where you should see the movement of the vocal folds. If the vocal folds are moving symmetrically, normally, then vagus function is believed to be normal. The third test that you can do during assessment of vagus and glossopharyngeal nerve is swallowing test. So you give the patient a glass of water and ask them to swallow it normally. If there is no cough reflex or no problem with that, then vagus nerve is believed to be normal. Okay, so now we move on to 11th nerve, that is the accessory nerve. Here the patient is asked to shrug and you are trying to bring the shoulders down. Patient has shrugged, you try to forcefully bring the shoulders down and you ask the patient to resist. This tests the function of the trapezius muscle. And you can also ask the patient to turn to one side, place resistance against the other side and ask them to turn away. Turn away. You place resistance on one side and ask the patient to turn towards the side against resistance. So patient is asked to turn their head against resistance. This tests the sternocleidomastoid muscle. So wherever you have placed your hand, you ask the patient to turn towards that side against resistance. You are providing the resistance, and the sternocleidomastoid muscle will be helping the patient to turn their head. Sternocleidomastoid is supplied by the 11th cranial nerve. So you're testing the functions of the normal functioning of two muscles, trapezius and sternocleidomastoid, to examine 11th cranial nerve. Finally, the 12th cranial nerve is the hypoglossal nerve, which is responsible for tongue movement. So first you have to examine the tongue and notice if there is any tongue muscle wasting or not, and then you ask the patient to stick out the tongue and move it from one side to another. Just observe the symmetrical movement, voluntary movement, and largely effortless movement of the tongue, if it is present or not, and that if there is any fasciculation present or not, any wasting of tongue muscles or not. This is how you examine the hypoglossal nerve. So this concludes the examination of cranial nerves. I hope you were able to understand it, and I know I could have explained it much better with the help of a subject, with the help of instruments, but this is how I explained it today. And if at any stage you felt it was difficult to understand or something I oversimplified, or even if something I made a mistake in explaining, please feel free to reach out in the comment section below. Cranial nerve examination can be asked during MBBS ENT evaluation. It can also be asked in MRCS ENT OSCE MAND exam. So very important to practice this, and very important also from the knowledge point of view to remember which foramina of the base of the skull each cranial nerve exits from. So this is something you should know, and maybe I'll talk about it in the next video. Thank you for watching this video. Take care. Bye-bye. And please don't forget to be awesome.